Okay, good morning. We're here for a Marion County Board of Commissioners meeting. It's Wednesday, February 10th, 2021. We're in the Senator hearing room and it's 9 a.m. And as always, we start with the Pledge of Allegiance, so if you'll join us. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. So we're, it's good to be back, by the way.
Welcome back.
You know, I was going to show you my new face mask that I wore a lot when I was on vacation.
It's very nice.
Do not disturb face mask. So, but it's good to be back with you. Thanks for taking care of business while I had a little bit of time off. We have somebody signed up first thing, public comment. Paultrudeau, if you would like to come over here, and I think you're going to have the handheld mic. Good to see you this morning.
Thank you. If I may hand these to the Commissioner.
Thank you.
It's on a piece of tree because I tend to go around the tree a lot. I don't want to do that. Hand out what I'm going to say here. Okay, if I may take off my mask because
You just talk right through it. We can hear it. Yeah,
Okay,
there'd be
all right.
no problem.
I might
Thank
have
you.
to chew on the mask.
I know they're kind of a pain, but we need to do it for your safety and ours.
Yes, okay. Thank you. Well, thank you, Commissioners. I am Paultrudeau. My wife came with me. She's sitting in the back there.
Just hold the microphone up so he can pick it up in there. Thank
We
you.
are here today to ask for your help. My wife and I own property at 21100 Butteville Road in Donald. We are not in litigation with Marion County or the city of Donald, nor have we threatened any litigation. I want to make that clear. I know that someone in Marion County has told you otherwise. That is not true. We had a case a couple of years ago against Marion County, but that case is over. If the county attorney or county administrator tells you otherwise, they're not being honest with you. My glasses are fogging up, I'm sorry. In 1992, my wife and I purchased land in the city of Donald in order to move and to grow our family business. In 1999, we submitted applications and were approved by Marion County Public Works for permits for 2 driveways per our approved plans. I paid for those permits that were issued by Marion County Public Works, and I completed all the requirements, including culverts, catch basins, utilities, and grading per Marion County and the city of Donald. There was one requirement not completed. I did not pave the driveways which were necessary to final those permits. All was ready for the required paving when I was involved in a horrific accident. My wife was told to get to Salem General Hospital immediately if she wanted to see her husband alive. She made it there, and obviously I did survive, but with some lasting effects. What I ask my commissioners to understand is that Betty and I pay out of our pocket for after taxes for everything. That includes hospitals, doctors, surgeries, everything, including especially our property development in the city of Donald. The drives did not get paved before the permits expired because of the medical expenses I had incurred. What I assumed at the time is that once I was financially recovered, that I would be able to pave the drives. We have run a small business out of our 7,000 square foot building on the property. Times were tough, and so I wasn't always in a position to afford to pave the driveways or finish developing my property as Betty and I intended to do for 20 years. In order to be able to develop my property and to create a space where small businesses can start and grow, I need to pave the 2 driveways that are already there. The city of Donald has expressed support for my project. The only thing in my way is Marion County. According to Marion County, the driveways were fine in 1999 when permits were issued. Now, one bureaucrat in Marion County is standing in the way of economic development. My engineers say that the location and the use of the driveways is fine, but one person in Marion County is standing in the way of economic development in Donald. I have reached out to Commissioners Willis and Cameron personally and have not heard anything from either of you. All three of you campaigned as champions for small businesses and supporters of the local economy. We are now before you pleading our case because I am out of options. I need my county commissioners to go to bat for me and not to hide behind the bureaucrats in Marion County. I am glad to entertain questions at any time, but I really do ask that my commissioners would come to Donald to see firsthand my drives. Thank you for listening. Thank you more for your help because somebody must. I ask your permission to pave my drives on Butteville Road in Donald. Thank you very much.
Thank you for coming in and presenting to us. I really appreciate it. I know we had a phone conversation quite a while back, and I know this has been going on for a very long time, and we will look into it and get back to you.
I appreciate that.
Thank you.
Thank you very much.
Mr. Chair, if I may.
Yes, go ahead.
Mr. Trudeau, and I may have forgotten this, but I don't remember ever having met you or talked about this issue. So I apologize if we missed emails or something, but
I sent letters out to all of you folks, except, well,
Commissioner Beth will know. Yeah, right.
She was not the commissioner at the time.
okay.
Yes,
But I might have missed those.
I'm sorry you did, but that's not my responsibility. I sent them out.
Okay.
And so I sent them out also to the reps, the state reps that represent me in Donald. But they don't have the authority that you do, okay?
Well, we're happy to look into it.
But I do appreciate your, so I am, is there anything else here?
Nope. That was
Okay.
Oh,
Thank you.
Thank you for coming today. I really appreciate it. Okay. And thank you for your wife to be here too. Appreciate it. All right, so we're going to go to our weekly presentation on COVID-19 update. Katrina is here with us. Good morning and welcome.
It's the chair thing, I'm just saying.
Good morning. I'm Katrina Rothenberger, the Public Health Division Director for Marion County Health and Human Services. And this is our COVID update for Wednesday, February 10th. As of today, we have 17,837 total cases since the beginning of the pandemic in March of 2020. However, in the last 2 weeks, we have had, between January 24th and February 6th, there have been 1,002 cases. 269 people have died of COVID-19 in Marion County, and our percent positivity rate since the beginning of the pandemic went down from 9.4% to 9.3%. There are currently 26 residents in the hospital with COVID. Last week, we reported 23. This is down much further from where we were over the winter when we were reporting about 50 to 60 people in the hospital. For Region 2, in Marion, Polk, Yamhill, Lynn, Benton, and Lincoln counties, there are 124 adult non-ICU beds available out of 787 and 39 adult ICU beds available out of 126. And there are 35 individuals hospitalized with COVID in Region 2, which was down from 36 last week. The case rates continue to decrease in Marion County and in the state. There was a 7.7% decrease in cases in Marion County over the last 2 weeks, which was January 24th through February 6th, compared to the previous 2-week period before that. The percent positive test is higher in Marion County than in Oregon, 9.3% versus 5.9%. And the bulk of cases are coming from Woodburn, Kaiser, Central Salem, and the Northeast Salem Brooks zip codes. Many folks are wondering how we can go down from extreme risk level to a high risk level so that more of our businesses can reopen. And in order to be lowered from extreme to the high risk categories, we must have fewer than 200 cases per 100,000 for a 2-week period. And in Marion County, this is 695 new cases over a 2-week period. And from January 24th through February 6th, we had 1,002 cases. So we have a little ways to go to decrease below the 200 per 100,000 threshold. Our percent positivity rate, in order to move down a risk level, needs to be between 8 and 10% over the 2-week period. And that 2-week period I keep talking about, January 24th through February 6th, our percent positivity rate was 7.9%. So we are under that percent positivity threshold already. I also wanted to mention how we can all do our part in order to help those case counts go down. We have to continue wearing a mask in public areas, physically distance, limit social gatherings, and staying home when we're sick. One thing that we used to talk about a lot that I haven't mentioned in a while is that if you're being tested for COVID-19 and you need a few days to wait for your results, please stay home because we don't know your COVID-19 status. And then if you're offered the vaccine, please take it. We'd like to see about 70% of our population be immunized in order to reach that herd immunity goal. We can't necessarily do that right now because the vaccine is not approved for children. So for adults, we still want to see about 70% of folks being immunized as those vaccines become available. About 50,000 people in Marion County have been immunized with their first dose at least. This includes over 40,000 people in Phase 1A and just under 8,000 people in Phase 1B, which includes child care providers, early learning, and K-12 educators and staff. And this week, we're also beginning to immunize folks over the age of 80. We're also receiving questions about where's our vaccine going. So Marion County is allocated a certain number of doses every week. For this week, we received 2,600 doses. About 75% of those went to the North Marion County area and providers in that region. 700 doses went to Santiam Hospital, which included 400 for folks 80 and over, 200 for educators, and 100 for Phase 1A, Group 1A. 1,000 doses to Salem Health, and those will be primarily used in the Woodburn area. 600 doses to Legacy, and 100 to the Silverton Pillbox, and 200 stayed with Marion County Health and Human Services for some special vaccine clinics. I understand there's some frustration with many seniors that have not been able to sign up to receive their vaccine, and we are working with our partners to make the appointment process easier for our community. Several providers in Marion County, Salem Health, Santiam, Legacy, Salute are offering appointments. And try to keep in mind that demand for the vaccine is very high and supply is still low. We anticipate it will take through mid-April to get everyone over 70% of those over the age of 65 immunized. An appointment may not be available right away. If you're able to get on a waiting list, we would recommend doing that. Continuing to check in and helping your elderly friends and family navigate this system, because right now it's not exactly easy or intuitive. There's many websites to check and phone calls. We're working on a process to try and make that a little bit smoother, but we're still working through some of those logistics. Let's see. Well, I think that's all I had for today.
I just want to reiterate the need for helping our seniors. It's been about a week and a half since the information's been out publicly that we're working on the 80 plus folks, and I would say our office, which is in partnership with the health department, but not to answering their phones, our office has received probably hundreds of inquiries via email or phone or other formats of trying to figure out how to engage those various systems to sign up. And so if I had a parent that qualified, or grandparent for that matter, I think it would be my responsibility to help them over that technology barrier. So it's a lot of calling, it's a lot of figuring out who has what and how you get into it. And I know all of our providers are trying to make the process as simple as possible, but there's information that's required, and there's, not like an abundance of vaccines right now. So just please stand forward and really facilitate that work on behalf of that 80+ population right now, so we can get them in and get those vaccines to them as soon as possible so we can continue to move forward. It's really important.
Great. I know my dad's 88, but he drives Uber, so he could actually pick up some people, and
Nice.
I can't believe he's
That's
still going
amazing.
at 88 driving Uber. But yet he's obviously he's on a phone because
Right.
he's doing Uber and stuff. But he says, I'm not worried about it. I'm not worried about it. I said, Dad, you need to go get vaccinated. So I got to help find a place for him. I just wanted to thank you, Katrina, again, and Ryan and your whole staff for all the work that you've been doing, and continue to be responsive to the requests that are made to you and the department every week in all the meetings that we're in on this issue. And we did have a citizen who actually asked a couple of questions that could be answered today at board session, and I think you did, but the question was, what are citizens supposed to be doing that we're not already doing to get ourselves into a lower bracket? And I think we say it every week, and I was teasing about my different face masks. We've got to wear a face mask. We've got to sanitize, use hand sanitizer, wash our hands. And I think, as we all know, a lot of these cases come from social events that are outside. Obviously, they're outside of restaurants because restaurants haven't been open in Marion County, and it's people congregating in congregation settings and not being thinking that they're safe now because they're not out with other people. But that's where a lot of the transition's happening. So I don't know that his question was that we're not already doing. I think we just need to do more of that and continue, obviously, with the vaccines. That will help with keeping people healthy. And then I think you did explain where all his other question was, where have all the vaccines gone? Mm-hmm. And that's, I think, that's one thing I know that we asked the department to do 2 weeks ago, was to kind of gather our partners together and find out what was going on. And you guys have done a great job with that. Not guys, you professionals have done a great job.
Thank you.
You all.
Well, and Mr. Chair, if I may, we know where the vaccine's gone. It's all gone to Portland. And I think that's something that needs to be said, which is, Katrina, you and your team in Salem Hospital and Santiam, our healthcare partners, did a phenomenal job in January getting that vaccine out really, really fast. And we got over 50,000 doses of vaccine out. And basically, since the beginning of February, our partners and us haven't gotten very much vaccine at all. And that's a reality. And I think that impacts, our numbers are dropping, and I think people should take confidence in that. We've had elevated case numbers since the beginning of the pandemic. It's not like our numbers today, or in fact, today they're lower than they've been at any time before in the pandemic. So we've had further to go to get down to that 200 per 100,000. But it's harder if the vaccine gets pulled from your community and sent somewhere else. And that's a reality that we're dealing with. And that's also why it's hard for our seniors to get into the clinics, is because there's just a shortage of vaccine. So, and that's something that, these are hard decisions, and people have to figure out what the best way to allocate a scarce resource is. But that's part of the situation we're facing as well.
Yeah, and I think Commissioner Bethley mentioned just patience. Just people have to be patient because there's limited resources, and it's been a long, long haul. I remember last March, just, where I was when all this took place, and we were in here on Saturday doing an emergency board session, and here we are still. So it's going to be a while, and I just don't know how, the economic development, economic recovery is going to be really, really hard. But the main thing right now is staying healthy, trying to do the best we can.
I'd just like to add that it is, we do need to have patience, and it is a hard process, but I think that we can look at the processes in every county, or the virus in every county, and determine where the need is really required for vaccinations. And I really think that Marion County has a significant need, specifically in the North County. As Katrina mentioned, our BIPOC community has been heavily hit, and I understand there's a process that's never happened before. But if we're talking about really saving lives, then I really feel like a priority should be created for the communities that are hardest hit by this, because their lives matter. And I think that the governor and her team really need to kind of show up with the words that they keep talking about, and make sure that Marion County, specifically the North County, gets what they need so those folks cannot get the virus and or die from it. It is really critical. And I am worried about our partners. It's very expensive to set up a clinic such as the size of Salem Hospital, and then not have vaccinations to give out. And I'm concerned about what that looks like, because we rely on them. They're a critical partner, and they need vaccinations or vaccines to vaccinate people. So I'm trying to be patient, but like many of us, there's some frustration and maybe a lack of understanding about what priorities and what their definitions are, and why we're not really executing on the reality of who is being hurt by this.
Yeah. And I know, did you talk about the Woodburn clinic that's coming up?
I didn't. So we do have a vaccine clinic in Woodburn High School on Thursday. The information should be on our website. I don't remember the exact hours.
Yeah, that's okay.
Yeah.
But I know with what vaccines we are getting, we're doing some of the things that Commissioner Bethel just mentioned, and then I think a decision yesterday with another 100 or so that we're going to try to reach out to another underserved community to make sure that they're taking, what we have is we're doing. And I remember when we sat there and talked about this plan before vaccines were coming, it was 3 months before we ever saw a vaccine. We sat upstairs and we talked about what our priorities were, and it was really easy. It was just the data, and a few of those things that got changed. Teachers weren't necessarily on our list as people who needed to be vaccinated first. It was the senior citizens, it was the healthcare homes, it was all where things were breaking out, Woodburn, those types of places. So I just want to say thank you for how you and your team have reacted to, life isn't fair, but how we react to it, what's dealt to us, is really staying positive. And I just want to say thank you to your team and staying positive and reacting in a professional and positive way with the hand that we're being dealt. And it's going to continue to change every day. So thank you.
Thank you.
The vaccine clinic tomorrow in Woodburn is from 9 to 1. While we were chatting, I pulled up the flyer.
Is it tomorrow? I thought it was Saturday.
No, it's tomorrow.
Thursday.
Thursday. Let's say today's the 10th, so tomorrow's the 11th.
All right.
Thursday the 11th from 9 to 1 at Woodburn High School. Only for people 80 and older. All are welcome regardless of immigration status. Your information is confidential. No insurance required, no ID required. So before you show up, call your own provider. Make sure that you're safe to receive that vaccine, so the process is expedited when you arrive. And we have, how many up there did we, is it close to 500 vaccines?
They are able to do up to 500. So I'm not sure what their
Yeah.
capacity is, but we did allocate 500 for that specific event.
Perfect. So tomorrow, 9 to 1 in Woodburn.
Yep. I'll have to text my dad and have him Uber up there.
There might be people up there he could pick up on his way.
Yeah, exactly. Take somebody. That's a good idea. He may have some neighbors. He lives out south in a retirement community.
Yeah.
Yeah, that's a good idea. Okay, thank you. So I don't know whose turn it was, who did consent calendar. You probably did it last week, so.
It's a team effort.
I did do it last week.
Yeah,
in
so why
fact.
don't we
Yeah.
go over here to our vice chair today.
Okay. Mr. Chair, I move to approve the consent calendar for Human Resources. They'd like to approve a recommendation to uphold the pay grades for classifications number 475, Facilities Analyst, and number 172, Sergeant, and adjust upward the pay grades for classification number 174, Lieutenant, number 180, Undersheriff, number 268 Division Commander, and number 269 Division Commander institutions. In Public Works, receive a notice of hearings, officers' recommendation, and schedule a public hearing for February 24th, 2021 for Comprehensive Plan Amendment Zone Change Partition, CPZCP, case number 19-005, Lois M. Fenig, trustee of the Henry O. and Lois Fenig Trust. Also under Public Works, schedule final consideration to adopt an administrative ordinance for February 17th, 2021, granting zone change, ZC, case number 20-006/J Concert and Sons LLC. And also under Public Works, approve an order reappointing Brent Stevenson and Richard Walker to the Marion Water Quality Advisory Committee, NWQAC, with terms ending February 10th, 2025.
I'll second the motion.
Okay, we have a motion and a second on the consent calendar. Any further discussion? Seeing none, hearing none. All those in favor signify by saying aye.
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 Aye. Okay. All right, our first item under action is finance. Approve a quitclaim deed for the sale of property tax ID number R100485 to the city of Jefferson, the amount of $10,000. All right, John's here.
All right.
Oh, and Camber, right in front of you. Welcome, good morning. Does that mean we get to watch a show?
Oh.
That's next.
Oh,
Commissioner.
okay.
Oh.
Oh, yeah.
Yeah, not for this, good morning, Commissioners, just for this, as we discussed yesterday, this is the quitclaim deed transferring the former gas station from Marion County Finance to the city of Jefferson. All the environmental requirements have been met and the city is paid in full. So pending your questions, it should be before you.
It's taken 2 years. Glad to get it done.
Yeah, it's been a long case, long.
I don't have any questions, but I'm excited about it. Anytime you can take a flat piece of nothing and turn it into something great, good job, Jefferson. So make it happen.
Yeah, good. All right, so I'll take a motion.
Mr. Chair, I move that we approve a quitclaim deed for the sale of property tax ID R100485 to the city of Jefferson in the amount of $10,000.
I second the motion.
Okay, we have a motion and a second. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Aye. Motion passes. Okay. I'm going to recess the Board of Commissioners and open a contract review board under Health and Human Services. Consider approval of an order granting the contract specific special procurement exemption to establish a contract for services with Paxis Institute, Inc. to provide PAX Good Plus Good Behavior game kits and facilitated training for schools located within Marion County. And we're going to add Susan to the conversation. Thanks, John.
Good morning, Commissioners. My name is Camber Schlegg. I'm the Contracts and Procurement Manager in Finance. And with me today is Susan McLaughlin. Good morning.
Good morning, Susan.
And we are before you this morning for the approval of a special procurement. This special procurement was posted to the Oregon Procurement Information Network on January 11th, 2021. It did close on January 19th without any protests. Pursuant to Oregon Revised Statute 279B.085 and then Marion County Public Contracting Rule 20-0285. This does meet the need to fit within a special procurement. Paxis is the only company that provides this particular game that the county has been using for the schools, which Susan will talk about briefly. Otherwise, if you have any questions regarding the procurement process before you today.
No?
Okay, all right, I'll turn it over to Susan.
Okay, well, the PowerPoint, if you don't mind, Camber,
do you want to
is
trade me?
sitting right in the middle, or I can trade you, whatever works. Good morning again, everybody. Everybody got a good night's sleep since I saw you yesterday? All right, so good behavior game, what the heck is that? It's kind of a misnomer. It's a curriculum, it's not actually a game. It's not a very traditional curriculum in that it's not a set of lesson plans for teachers to use that happen once a week for an extended period of time or for a 2-week period in the classroom. The good behavior game is more a set of lessons or strategies that teachers use throughout their day. It's an elementary-based curriculum, so we're using it in our elementary schools from kindergarten through 6th grade. And it works day to day to build students' behavioral skills and stamina for focused attention and self-regulation. Self-regulation becomes important because the better a person's self-regulation is as they move through time, research shows us that that helps us to avoid risky behaviors that lead to things like substance use or depression. So it's very interesting. We'll talk about some of those outcomes as I move forward. Students take self-regulation with them in the hallways to their research or to recess and into their homes and communities and throughout their lives. So it also is something that doesn't just happen in school. It ripples out through the community and long-term over time into their lives. So that's also a nice benefit of this program. Studies from Johns Hopkins have been going on for quite a while. This program is not new, but it is constantly being updated, so that's great. And we do know that over time, and I'll share some of those outcomes with you as we move forward, that students are more likely to experience success in school and have significant positive outcomes when it comes to substance abuse, addiction, and mental health. So here are a few of those outcomes that I'm talking about. So in the very short term, it improves classroom performance. And after we did our pilot group of trainings in our county, we went back and we talked to a whole lot of the teachers and said, is this really working? Are you really experiencing these things? And the overwhelming majority of them answered very positively in 6 different areas that we asked them about how are things going with using this curriculum. They love it. So longer term, students who have been part of a PACS classroom demonstrate higher statewide standardized tests in math and reading. And that meets a real need for our schools, and it gets the attention of administrators and allows them to be excited about the curriculum as well. Higher reading levels are great. It also translates to reduced need for some of our special education services. So kids who are building attention span, kids who are self-regulating, kids who are avoiding behaviors that get them into trouble, for lack of a better word, in the classroom, don't need quite as much of that specialized attention in their daily classes. Higher graduation rates and college entrance rates have also been noted. And then our teachers, it's also important to note that our teachers who are using these strategies in their classrooms are really noticing positive changes in student engagement. The strategies work, the classroom management is easier, and as a result, they feel like their own personal stress, as well as this overall level of stress and anxiety in the classroom, once they start implementing these strategies, really goes down and makes for a much nicer environment, a much smoother environment in the classroom. Here are some of the outcomes that the research has provided, and I did take this from the PACS itself. So the mental health outcomes, some of those are that kids have remarkably fewer problematic behaviors in the classroom, and a lot of that has to do with them being able to cope better with what's going on in their own lives. Violent behavior, criminal behavior goes down in classrooms as compared to that standard or the control classroom that did not have good behavior game going on. Suicidal thoughts, even suicide attempts are fewer over the long haul. As far as substance use or those kinds of preventions, we see really positive outcomes with decreases in tobacco use, decreases in alcohol use, and decreases in other type of drug use, including opioids. So less overall services in the long term need to be spent dealing with those types of problems in the school environment and in a person's health because we prevented them from happening when they were young. So those things are exciting. I wanted to step back just a minute and talk about how and where we've been using this in Marion County and how it led to the need for a large contract to pay for some of these trainings. About 2017, through the education service districts, at conferences around mental health or around education or around prevention, we started to see presentations about Good Behavior Game as an evidence-based program that was showing some really great outcomes in its research, and as something that some of our state grantors were supporting as an option for us in our work plans. So in 2017, our own mental health promotion program, which is one of our state-funded programs on the prevention team at Marion County, at that time we were doing a lot of work implementing suicide prevention programs, gatekeeper trainings and teacher trainings and those sorts of things, starting a coalition in our Marion and Polk region. But one of the things that continued to be identified was that we really needed to do some mental health programming that was way upstream. We had curriculum for community, curriculum for high school, but what about younger populations, and how do we get out in front of that before the depression and the anxiety and that suicidal ideation start showing up? So go way upstream before the risky behavior or the risky negative outcomes start. So in the back of our minds, we put a little bit of a cash into paying for some pilot programs with Good Behavior Game. We had some staff vacancy and a little bit of cash flow, and so we spent that extra money partnering with our WESD to pilot some programs. And over that 2018-19 school year, we were able to partner on 6 trainings and help pay for about 55 Marion County folks to be trained in 5 districts in Marion County and 1 private school. And so we started looking at our data, and I'll show you later where we've been, but it was North County were our first schools. Mount Angel was one of our target communities based on data, and Woodburn. And then from there we expanded in the North County to Jervis and North Marion. A couple of Silverton districts at that point, and then 1 private school. So as I mentioned before, we did some surveying of folks. How's it going? Do you like this? And we got really great feedback. And once schools send a couple teachers through, they love it. They want to train their whole school and then train their whole district, all of those elementaries. So we jumped on board in 19 and 20 with the WESD. Our neighboring counties are also offering this with various funding sources. And so through partnership in that school year, which ended in October of 19, we were able to participate in quite a few larger scale trainings and trained up another 107 teachers and staff, and 92 of them were Marion County. And at that time, we also were able to include some Salem-Keizer staff because we were excited about offering that opportunity to one of our larger districts, and it is the 2nd largest district in the state, so important to get them involved, as well as to offer it to one of our tiny districts down south, Jefferson. Of course, they loved it. Everyone wants more. But what happened was that our funding ran out then with that school year, and it happened to be October 2019, which is right before COVID hit us. So that was unfortunate. However, in my job, I really love this program, and we really advocated the health department for things that really work across many programs. And so as I look at how the Good Behavior Game curricula or program aligns, it does a great job across our department goals as well as our individual programs. So you can see that our CHIP priorities, or our Community Health Improvement Plan priorities that were identified through a community process and a lot of data, are to work on substance abuse, behavioral health supports, and housing over a 5-year period here in Marion County. And this curriculum really aligns well with that, and it meets some of those targets, and it will help us longitudinally to work through that. We're also undergoing a modernization process right now. Public health is working diligently to do things at a population level. and to work upstream and to consider social determinants of health and targeting specific populations. And we're able to do that with this curriculum. We're casting a very wide net. With this grant, we'll be able to pay for quite a bit of training in many districts. And although we know we can't pick up every teacher everywhere, we can start with a very targeted approach to which schools do we approach first, which ones do we recruit into this, how is that the priority, and then how do we gather folks in beyond there. And then at the program level, we have mental health promotion program that is really the house of this program. Our staff there are the subject matter experts that are helping coordinate these trainings, and they work pretty closely with the WESD on some of their mental health initiatives and school-based trainings. But it meets our marks around prevention of youth depression, anxiety, and suicide, so that's great for us. We may not be able to measure that tomorrow, in that if we train and work in elementary school today, we don't have those, we can't measure what we've prevented tomorrow, but looking down the road, we should have some of those positive outcomes that we can notice, especially if we go community-wide or multi-county regionally with this training. Our alcohol and drug prevention program, as well as our tobacco prevention program, also should see some impacts from this, as we see in the outcomes there. Good outcomes with substance use and tobacco and vaping prevention. That also has long-term impacts on chronic health conditions. And then even our Title V funds. The statewide goals for Title V in July are going to move to having some pretty serious goals around training and awareness raising and trying to work on adverse childhood experiences. And when you look into this curriculum, a lot of the strategies that they're working on are really based in acknowledging those ACEs and working in trauma-informed care. So it really fits very well amongst our prevention goals. So the good news then is that what we're asking for in this contract is that we have received a grant that we would like to spend on good behavior game training. The grant will run through June 2022 and give us quite a bit of time to organize trainings. Most of the funds here will just pass through and be spent on training. Costs about $400 per teacher to train them up on the curriculum, and that includes all the materials that they're going to need to be successful. So our plan is pretty conservative. We're hoping we'll get more than 400 teachers trained, but that's kind of our baseline. So it will train the initial teacher training, and that also does include administrative or support staff or counseling staff at the schools that want to join that training. There's not a requirement that you be a certified teacher to go through it. It's anyone that works with kids in the building. And we're going to be offering those monthly for teachers to sign up. We have great recruitment already and good partnership with the ESD partners to help us to recruit teachers into that. We're also investing in what they call PACS partner training, and this sets up for sustainability and long-term success of this program. So within each district or within each school system, we're hoping to identify and then provide additional training to PACS partners who will then mentor new teachers who come in and get them into a training cycle. And for a long term, we're not anticipating we support this program financially forever, but if we have a whole district trained, then when there's a new teacher, new single teacher or two that come in, it's much easier for them to provide that one-time training for a single person than their entire district. So that's kind of where we're going with that. And then we'll have the PACS partner in place to coach them and tell them how it's been working in their school and get them into the process. And then each person that goes through training receives one of the supplemental materials kits, which I left upstairs yesterday. So I think it's still up there, unfortunately, but I'll talk about some of the components in it.
I'm nerding out upstairs.
Toodles?
Toodles. When you have little kids like me at home, you need all the tips you can get.
You need all the tips about the toodles. So, okay. Well, we can talk just about a couple of things that were in there. You can see in the picture that they're holding up their little goodie bag, and what's in those materials kits that all of the teachers receive is a copy of the teacher manual, which is a bunch of those strategies described and how to use them. And it's great information for teachers about what is the trauma-informed care piece here, what is the research say about using this in your classroom, how do you adapt it if this is a kindergartner versus a 6th grader, and then what are some of the things you can send home for parents so that parents and daycare providers are doing the same kinds of strategies with your kiddos. So the more folks that we engage in these positive strengths building activities with our kids, the more likely they are to adopt them and really learn from them. So they're going to get their curricula, they're going to get the toodles, and a toodle is the opposite of a tattle. And so it's the opportunity for people to catch kids doing the right thing and then reward them, not with a piece of food or a piece of candy or a toy, but reward them with a written comment and some praise for doing the right thing. I noticed that you really wanted to get out of your chair halfway through show and tell time, and you kind of sat there and I could see you were struggling, but you did it. You know, good for you, great job. It's that kind of positive reinforcement. They also have a little tag that says things are okay or not okay. So rather than calling out a person by name and calling to attention that perhaps they're misbehaving in class or doing something that's not a behavior that's desired, they have this little way to kind of cue with a point of a finger to that's okay or not okay. And this important change in how the language is, because for example, running is a good thing, right? But there are times and places where running is not okay. So rather than labeling running bad or the child is bad or you're doing the wrong thing, they just simply make some eye contact, point at not okay, and let that kid know to self-manage that it's not okay right now to be running in this situation. So lots of good tools in the toolkit for the teachers. The thing right in the front of the little picture on here is called Granny's Wacky Prizes. And yesterday I was able to pass around some of those really funny scenarios. The wacky prizes they earn are more behavioral. They're not intended to cost teachers anything. So you have 30 seconds to wiggle, or you have 30 seconds to sing a crazy song, or it's offering them some of those things that may not be desirable behaviors in all situations in school settings, but they earn the ability to do that by not doing them in class at the wrong time, right? Or at the inappropriate time, which they would call a spleem. So anyway, lots of fun things. And the entire cost for a teacher to get trained and get their supplemental materials kit that now is including an app, access to an app. There are also right now a lot of online tools and online games that have been created to work in these COVID times. So it's not like nothing can happen if you're not in a classroom setting. They have been adapting to this online world and helping teachers with that as well. So that's a little bit about the materials kit that's sitting, I'm sorry to say, upstairs.
In my
I
office.
didn't think about it till just now, and I was like, I don't have another one in my car, I don't think. So I apologize for being unprepared.
No, you don't have to apologize. We know who to blame.
Yeah, it's not your fault.
Well, thank you for the grace. So last thing I'll say is just a little bit about our plans for implementation. Currently, we have teachers trained up and working with Good Behavior Game, whether they're online or coming back to their in-person school here this year or next year. In Woodburn, North Marion, Jervis, Jefferson, Silverton, Mount Angel, and a few of those teachers in Salem-Kaiser. And I will say I went back and I looked to see where did they get trained up, because I didn't remember it being Richmond. And it was Hood.
Hood Elementary?
Yeah.
I don't know what, that's in Salem-Kaiser? I've not heard of it.
Yeah.
Well, then they have
And
a
some in
partner
Baker.
program that's exactly like it
Yeah.
over there.
So there were a couple of different schools, and then what I figured was I know there were some folks from the district office that attended that, and you know, teachers move around, folks move around. So
Maybe
perhaps
maybe
they thought this
partnered.
is really great, and I was so happy to hear that they were using it somewhere, and now I'm going to touch point with them.
Well, I'm gonna email them and say, did you partner up on this and just bring it over? And I did
Yeah.
offer Commissioner Willis a tour of that classroom. Superintendent Perry doesn't know that yet, but I very
Yeah.
much want people to see it.
Well, and once we get back to some in-person classrooms, there are places around the county that have just loved this. In Jefferson, Mount Angel, Woodburn, that have been using it a couple of cycles now, and they would love to have you. So that would be exciting for us to be able to make that happen. As far as the next group of schools, we're filling in new teachers or new schools in Woodburn. We have one more elementary school that wants to train up now. We just got some emails from them in the last week or so saying, so we hear that there's training coming and they're excited about it. We'll be recruiting additional folks from Salem Kaiser in targeted areas where we feel like there's the most need first. And then we're also partnering with Polk County Public Health for a couple schools over there that are high need areas such as Falls City. So it's pretty exciting. We're hoping this will catch, like I said, a large enough web over the couple of years that we have a lot of teachers trained in our region. Partnering counties of Yamhill and Benton are also working with this curriculum. So we're hoping as folks are mobile and kids and families are mobile that they'll be able to, not only within our county, but within our region, experience some of these same positive techniques going on in elementary classrooms that downstream will have all these positive outcomes for our population.
Great.
Great. Really good stuff. Anything? We got to hear this presentation again.
I
Anything
know.
new come?
No.
Toodles.
I mean, yeah, toodles.
Toodles.
I mean, of course, as you were joking about that, I thought, we should implement something in the county. Toodles.
Toodles. I like it.
I mean, I think we do recognition
Well,
for a
it's
variety
kind
of
of like
things. but-
kudos, right? You
Yeah, it's
know,
kudos,
give people
absolutely.
the kudos.
I know, I love it. I think it's great anytime you can do any kind of positive reinforcement in all walks of life. And, you know, for the kiddos that have the opportunity to experience in their classroom, maybe it'll transition to home and their siblings can be impacted and, you know, just kind of that learn by experience and grow with it. For me, suicide prevention is going to be a priority. You'd mentioned yesterday that there was, you know, some attention drawn in the last couple of years because we had just a significant amount of unfortunate teen suicides. And whatever we can be doing really to see those kids is important. And if this is something that starts at a young age and helps them establish potential skills, great. So thanks for bringing it here.
Thank you. Well, that's my pleasure. Thank
Okay.
you very much for having me.
I really like when we get to serve our community, you know. I like being a resource. I mean, one of the things that's, I had never heard of this program before, but as you were talking yesterday and today, it just seems like something that that we're helping our schools out, that the teachers want this and this is helpful to them and we're able to be a partner and step in and really provide a resource that they don't have. So I think that's a great role for the county and thank you for doing that.
I do have one question, sorry. This is, how long is the grant? 2 years? It ends in June 2022?
Well, it's a dollar amount, and technically it was for this calendar year, but when we put our proposal in, we thought it would take us more like 18 months to execute it, and they were fine with that timeline.
I would love to hear back from you in a year to see who, you know, kind of invested in it, what that impact looks like now and what their goals are long-term. You know, I think one of the things that individuals that do good things don't do well is brag about the good things. So I'm sure that there's good to come of this, and I'd love to hear about it in a year.
Thank you. I'd be happy to give you updates anytime.
Thank you.
Okay, so we're still in contract review board, if I remember right?
Yes.
Yeah. Okay. So we do need a motion under contract review board.
Okay.
Mr. Chair, just to clarify, my understanding is this special procurement is being done on the grounds that this is a sole source contract. This is the provider, Paxis is the provider that can provide these funds, that's why, or this program, and that's why it's not done as a competitive procurement. So that's the basis of the sole source contract.
Okay, good?
Yes? All right, Mr. Chair, I move to approve the order granting a contract-specific special procurement exemption to establish a contract for services with Paxis Institute, Inc. to provide PAX Plus good behavior game kits and facilitated training for schools located within Marion County.
I'll second the motion.
Okay, we have a motion and a second. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Aye. Okay, so we will close the Contract Review Board, go back into our Board of Commissioners meeting, reconvene the Board of Commissioners meeting, and under Health and Human Services, consider approval of the contract for services with Paxis Institute, Inc. in the amount of $200,000 to provide PAX plus good behavior game kits and facilitated training for schools located within Marion County through January 31st, 2022.
You want me to make that motion?
I'm happy to do it. Mr. Chair, under Health and Human Services, I move to approve the contract for services with Paxis Institute, Inc. in the amount of $200,000 to provide PAX Plus good behavior game kits and facilitated training for schools located within Marion County through January 31st, 2022.
And I'll second the motion.
A motion and a second. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Aye. Okay, that completes our business. You know what, I'm gonna follow the second vice chair's role, and I'll read the board's
A
calendar.
man for others. I
Let's give a round of applause.
You turned a new leaf today.
And
You
it's
were impressed
longer.
with yourself. I'm gonna toodles you by reading the calendar. How's that sound?
You know, you should just go like this.
True public servant.
Let me just.
True public servant.
All right, so we're reading the calendar from February 10th through February 17th. Today is the 10th, and we just finished our board session. And at 11 o'clock, we have a Board of Commissioners policy meeting located here on the 5th floor. Also today at noon, Board of BOC CAO meeting location here on the 5th floor. At 4 o'clock, we have a FEMA briefing with local officials, which is virtual. Tomorrow, the 11th, Thursday, at 7:30 a.m., Kaiser Marion County meeting at the Kaiser City Hall lobby, 930 Chamawa Road, Northeast, Keizer. What was it? What station? What TV station spelled it wrong? I saw that somewhere.
We're gonna blast them?
No. Never
Okay.
mind.
I mean, I'll tell you if you wanna know.
The new commissioner over
It's
there.
Yeah,
Kaiser.
they
It's
spelled it
Kaiser.
K-A-I-S.
I used to pick up my prescriptions at the Walgreens there on the corner
Yeah.
of Chamawa and River Road, and the voicemail
Yeah.
from Walgreens always said, located at Keizer.
I have that pharmacy now, and it's still the same recording.
All right. So I brought back some humor with us from my vacation. So also on Thursday, the 11th at 9 a.m., we have a work session for FY fiscal year 21-22 Economic Development Program Budget Discussion here on the 5th floor, the Commissioners Boardroom. Thursday at 1, Health and Human Services Policy Meeting, Commissioners Boardroom here on the 5th floor. Thursday, the 11th at 1:30, work session, Building and Planning Division update here on the Commissioners Boardroom on the 5th floor. That should be a good one. I think that's the update of what they've been working on for the last year to help us with finding more ways to build houses. Also on Thursday at 3:15, the Senate Committee on Finance and Revenue testify at public hearing regarding Senate Bill 464 wildfire property tax relief. And then on Friday at 11 a.m., Association of Oregon Counties weekly COVID conference call. Monday, isn't Monday a holiday?
Well, not for the legislature.
Wow. Wildfire, yeah, that's right. In fact, I told somebody I would testify on Monday and have a meeting Monday, so. At Monday, the 15th, at 5:30, wildfire recovery public hearings, and that's virtual. That is open from 5:30 to 6:30, I believe, for citizens that, victims, wherever that have been impacted by wildfires. I'm going to testify as somebody who is displaced, and that should be interesting if the chair allows me to. And then on Tuesday the 16th at 9 a.m., we have calendar review upstairs in the Commissioner's Boardroom. Tuesday at 9:30, management update, Commissioner's boardroom on the 5th floor. And I sent an email off to add Mr. Trudeau's discussion for that already to Brian, so you'll see that. And then we'll, on Tuesday at 2 o'clock, Health and Human Services Policy Group, Commissioner's boardroom, 5th floor. And Wednesday, we're back here at 9 o'clock in the morning. Wednesday at 10 o'clock, Community Disaster Loan Program is virtual. Wednesday at 11 o'clock, Board of Commissioners Policy Meeting, location on the Commissioners Boardroom here on the 5th floor. And finally, Wednesday at 4 o'clock, the weekly FEMA briefing with local officials, virtual. It's a long calendar. I think I'm going on vacation. So what happened this week? Or since, what did I
So
miss?
much.
You want to share anything? Or do you want to just go back to work?
Well, I do want to add that for Monday night on the 15th, for that wildfire recovery public hearing, of course, right now they are asking for citizens of the canyon, well, really, frankly, anybody in Marion County, because there was other fires also in the North County area, to come and testify, and it is at that 5:30 to 6:30 hour. But for folks that aren't available to sign up to testify in person, I would really encourage you to put pen to paper and or literally send an email to those committee members. They need to hear your story. Each one is very different, and you know, I didn't have a permanent home up there, but I had a leased space at Canes where...
Yeah, I could throw rocks at
That's
you.
right, we were neighbors. And my travel trailer and all of our property there burned down. And it's not the same for me as it is for the others, and I recognize that, but there are some significant hurdles through that process that even somebody who potentially is connected to the resources is trying to like climb over. And I hope that people really share what's on their hearts and in that process for them, because I know they need help, and I know that this committee wants to give them that help, but they need to know what that looks like. So you need to share.
Well, I think we keep flipping over rocks and finding more obstacles, and we try to knock those down. I know you, Commissioner Cameron, you were doing all the hard work, going up there and talking to the folks in Gates, and then as a result of that conversation, you got on a plane, but because of that work,
Danielle was with me that day.
yeah.
And Schrader.
Oh, it was on
He was
which
talking about
day?
the day we went up there and met
Yeah.
That's
Congressman.
right, yes.
Yep, and then as a result
And on
of
the
that
phone.
work, and of course you know this, but since we're talking live, we went and brought a check to Gates.
I saw that.
And, you know, it's one of these things where I know you were there in the beginning when all this was going down, and we first talked to FEMA and OEM, and they said to us, you know, there's revenue replacement for these cities. But I think for these cities that have maybe 1.5 staff, you know, who their homes got burned, to just the lift it takes to apply for these grants and to get through that process can be pretty burdensome. And I think we're discovering that and realizing that there's a place for the county to sort of step in there and provide that infrastructure and support to help them navigate some of these state and federal processes. So that's something we did. We also cast our 2/3 of a vote for Senate District, the appointee for Senate District 20. I guess Senate District 20, there's just a sliver of Marion County. Was it 64 voters
Yeah.
in the state Senate
Was
District?
that unanimous for Kennemer?
It was.
It was.
That's good.
Yeah.
Didn't someone cast 10 votes for another person?
No, initially
Okay.
in discussion, but everybody unanimously voted.
That's right. Good point. Yeah.
Yeah.
It ended up being unanimous.
I served with him in the legislature in the House.
Yeah.
Yeah, he's a good man.
Yeah. And then we started, as we talked about earlier, we started moving vaccines up to the Woodburn area to begin vaccinating seniors up there. So we did one clinic already, and as we talked about earlier, our second clinic is tomorrow, right, Commissioner Bethel?
Yes.
So that's some of the work of the last week.
Good, great. You don't want to know what I worked on.
I think there's pictures in there.
I probably sent you some pictures.
After the year that you had,
So-
if there's anybody that deserved a vacation, I think it was you.
So I tell you, the travel, you know, we had to do a COVID test before you left.
Mhm.
And then you had to do a COVID test before you came back. It all went really smooth, and it was interesting that, I think I shared this yesterday, that travel was good, and I just felt, I mean, just like our businesses here, you go to some place that's relying on tourism, and it's just not there.
Yeah.
You're like, and yet they are happy, and they're just so thankful that you're there. It's just amazing, and you feel safe. I mean, they had a curfew there at 8 o'clock, so you couldn't go out, and then that opened up till 10 o'clock, which for me, 8 o'clock's fine because I'm ready to
Me too.
to call it a day. But it's just great to travel and feel safe, and I want to encourage people to, be healthy, keep your hands sanitized. I wear a shield on the plane in addition to my mask, and if we can start to break out of this and get our restaurants open here, it's just we just got to keep positive and keep moving. Yeah. So, thanks for taking care of things while I was gone. It was a good trip.
I'm glad.
And
you
my daughter
had
and
the
her husband it was their wedding gift from us. So
There you go.
yeah, it was cool. They had a blast.
Good. I'm glad you came back healthy.
Well, I'm physically here.
Whatever.
Yeah. Okay, we're done. We'll adjourn.
Northwest artists. Let's welcome today's guest, Airport.